Can you define maybe what the difference between a gaming disorder would look like in comparison to like an internet disorder? Because I imagine like an internet phone disorder is kind of the same thing, whereas a gaming disorder is different. Is that right?
So, gaming disorder is an actual diagnostic category which is present in the diagnostic manuals, whereas internet addiction or smartphone addiction are not. So, I think that is
Hmm.
probably one of the
Wow.
main distinctions there. Both internet addiction as well as smartphone addiction and social media addiction, various types of internet addictions have been considered for inclusion in the diagnostic manuals, but in the present day and age, we do not have sufficient research evidence in order to include them. For that reason, gaming disorder at the moment is the only one of those that is indeed in the diagnostic manuals. It can be treated based on being present in those.
Wow, because from the research that I've seen online and read, obviously you're probably much more aware of, is that it seems like there is a lot of anxiety and depression coming from social media, et cetera. That's mostly used on computers and phones. So, what is your opinion that so far the DSM doesn't classify internet or phone usage as an issue yet, whereas gaming is? Do you think there's some movement on that? I'd love to hear where you think we are.
I think the main problem, really, with missing a number of diagnoses in the DSM or in the ICD is that there isn't sufficient research evidence present for any of those social media addiction, smartphone addiction, etc.
Hmm.
The research that we do have, which oftentimes shows association between extended use, excessive use, and various mental health related symptoms such as anxiety, depression, and addiction. It is mostly associations that we're looking at, not necessarily causative studies, so we don't necessarily know whether that particular technology use is causing those kinds of symptoms. Those studies are very difficult often to be replicated. There are problems with the research measurement tools that have been used in a lot of those studies. They cannot be compared across studies and across cultures. So,
Hmm.
from a research perspective, what needs to be done is to really engage in research that is both valid as well as reliable, that can be replicated, and that holds across different kinds of cultures. Once we're able to do that kind of research, to produce those research papers that give us those relevant insights, there may be possibility to reconsider the inclusion of other potential disorders in the diagnostic manuals.